Aspirus has made a commitment to the sustainable design, construction, and operation of the healthcare environment. The privacy, the cleanliness of the air, the lighting controls, the sound controls, everything is so much better up in this area compared to the old NICU. It's better for our patients, it's better for their families and visitors, and it's better for our caregivers.
I went to my doctor appointment on January 15, and he said Marcus was 1 pound 10 ounces. By the time they admitted me to the hospital, they pretty much told me he was coming C-section. He was born 3 months early.
And he's been here for 3 months. Phenomenal, just phenomenal. I can't say enough about this place.
I remember when they had the NICU downstairs, my cousin's daughter was also in that NICU. So I remember the big room NICU. And I remember, you know, I mean, it was baby here, baby here, baby here.
The space that we had before really was one room, and that was the patient room. We didn't have our own space. The doctor didn't have his own space. Respiratory therapy, nutrition, everybody was in one room.
We have seen the unit growing from a tiny little one-room situation, very crowded one, in which many times we had to work elbow to elbow to provide care for these babies. And now we have all this, plenty of light, tremendous facility that actually parents, many times when they're coming up from downstairs with a sick baby, already, stressed out, they open up here and they say, wow.
Our new NICU opened in August of 2009. And we built a single room concept design that we can keep 14 babies in. To start out with here, there's an alcove in between all of the patient rooms. This allows the nurse to be able to chart either outside of the room or inside of the room. We felt both options were very important. And not only can the nurse just sit out here, she can also easily view what is going on with her baby through the glass windows, and she can see the monitoring too. You then move into the baby section. The head wall is designed by the nursing staff and the medical staff, and it allows us extreme flexibility. We have a multitude of medical air and gases to use at our dispense, and we've had really no problems with it. We can position the baby in any position we need to for giving them ventilator support. The room has a lot of lighting levels, so we're able to dim lights, and we're able to make the room pitch black if we need to, or very bright if we need to. So that control has been a really nice thing to have, because babies do better when they're sick and not feeling well in a darker environment, a more calming environment. So being able to control that light has been key. We also monitor sound. So above you we have our SonicQ system, and I'm talking loud now, so it's in yellow, and if I clap my hands I can make it go to red. When you get large groups of people in the room, you get, maybe even one voice that laughs or makes a loud noise, we're going to easily go into the red zone. And what research is showing is that noise has an effect on infant development, and if you can control those noise and sound levels, that the babies have less stress, and they do better, and they go home sooner, and that's what we're all about. We're trying to get that baby home. Another feature of the room is the ceiling tiles, and they are the highest quality to absorb sound. So that's what we have throughout the unit. And then the other feature to help with sound is our rubberized flooring. It cleans very easily, and it also helps to absorb noise and sounds. So we have put in as many features as we can to control this room and make it the best environment for the baby that we possibly could.
Before I became a LEED accredited professional, I thought that sustainable design was really about saving trees or participating in a debate about global warming, and now I realize that it's much, much more than that. In our case, it's really more about the indoor environmental quality, clean air, air that we can really control the temperature and humidity, lighting controls, daylighting and views for our families and visitors, and a sound monitoring system that's really state-of-the-art and innovative. Very important for virtually every key member of the design and construction team to be LEED accredited professionals. That level of knowledge is so important in getting certification and getting the type of construction and quality that we're looking for.
It's such a calming environment when you walk in here that The security, you know the kids are safe here. It doesn't smell like a hospital.
It's a lot more organized and relaxed, and the flow is much easier. Our outcomes are much better. The babies progress better. They're feeding better because the stimulus and the environment is a lot more calm and relaxed, and going home faster.
Well, Marcus is going to be going home. He is now 4 pounds. I think he was 8 ounces yesterday, so he might be 9 ounces today. It's one of the best places I could ever tell anybody to bring their kids to.
It has made a wonderful difference. There's no comparison. We have done it. We're way ahead of many big hospitals, big city hospitals, and right here in the center of Wausau.
I think it's a great environment. I go to different areas of the hospital on a daily basis, and this is probably the crown jewel of the Aspirus Hospital.